If he hasn't benefited from alternative methods and has such complaints, we primarily recommend patient surgery with the method we call microsurgery. We suggest surgery if the patient doesn't have a loss of strength in his foot, doesn't have urinary incontinence, doesn't have complaints like incontinence of the large bowel, but suffers from pain. We primarily recommend surgical treatment methods from radiofrequency therapy. Because we administer radiofrequency therapy with a device and imaging methods, of course we rely on these methods. We don't encounter any risk at this stage, but as you know, each treatment method has a risk. Every procedure performed on the human body, an injection treatment you have done to your buttocks, of course comes with a certain risk, but these are reliable methods because they are accompanied by imaging methods. Since we do it, there is no problem, and our patients can continue their routine life after the procedure. So finally, this comes to my mind. Now, when patients come to us, they ask the most about the treatment we did. For instance, the patient recovered and asked this question, can this be repeated? Firstly, I want to ask this. And secondly, for example, we did radio frequency therapy. Is this a lifelong treatment? How often is it done? That is, will we do it every 3 months, every 2 years, or every 5 years? I would be very pleased if you give us brief information about this. Of course, not every patient may benefit from this, but it depends on the patient's life conditions, the work they do, the heaviness of their job, and their physical condition. That is, if they have been doing heavy work, they need to consider lighter work, they need to lose weight, and stay away from stress. Can the procedure be repeated? Of course, it can be repeated. We do have situations where we repeat the procedure in our patients between 6 months and 3 years. Of course, here we evaluate our patients with clinical and radiological findings. We also evaluate them with physical examinations. Well, in this manner, in today's video, we will show you non-surgical treatment methods for lumbar and neck hernias. We specifically talked about radiofrequency, so I would like to thank my esteemed teacher and Mr. Nakati in advance. We will put his own Instagram account under our YouTube video. You can reach him here. We thank you all so much. Wishing you a healthier, happier life.